You plan to work past age 65 and have health insurance through your employer, but you keep getting bombarded with information on Medicare and even hear that you're going to be penalized if you do not sign up for Medicare. Do you have to sign up for Medicare? Are you really going to be penalized? Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and in this video, we're going to walk you through this very scenario, which is so common, in order that you can have a better understanding of what to do and expect as your 65th birthday is approaching. Now, when we talk about Medicare, there's two parts, Part A and Part B. Part A of Medicare is your hospitalization, and if you're admitted to a hospital, Part A is going to kick in. All these years you've been paying taxes, and the portion of your taxes that went to Medicare paid for Part A. You've already paid for it. There's no premium going forward. Part B of Medicare is basically everything outside the hospital, so primary care doctors, specialists, emergency room visits, even outpatient procedures all fall under Part B. Part B does come with a premium, which in 2026 is $202.90 a month for most people. I say most people because it can go up based on income. Now, for many people, there's no sense in enrolling in Part B of Medicare if you have group health insurance elsewhere. In fact, this is often what we recommend for people turning 65 and continuing to work while having group health insurance that they're happy with. Sign up for Part A of Medicare because you've already paid for it. If you're admitted to a hospital, your group health plan will pay first and Part A will kick in and pay second. Then you deny Part B until you decide to retire because there's no reason to pay the premium for Part B when you have group health insurance elsewhere. Now, before you decide this is the route you should take, we always recommend that you check with your employer to make sure your group health insurance is considered creditable coverage according to Medicare for both your health insurance and your drug coverage. I mentioned earlier a penalty, and I'm sure many of you have heard about this penalty if you do not enroll in Medicare when you first turn 65. Medicare will add an extra 10% to your Part B premium for every 12 months you were eligible for Medicare and did not enroll. This penalty does not go away. You pay it every month for the rest of your life. It's the government's way of saying pay me now or pay me later. It's really frustrating, and it's really something we do want to avoid. As long as your employer coverage is considered creditable coverage, you're not going to be penalized for not enrolling in Part B of Medicare. You can go ahead and enroll in Part A, deny Part B until you decide to retire. Now, one real quick important disclaimer. I said earlier you want to make sure you have creditable coverage for both your health insurance and your drug coverage. Medicare views these separately, and there are occasions that the health insurance is considered creditable through your employer, but the drug coverage is not, so be sure and ask about both. This scenario, signing up for Part A and denying Part B until you decide to retire, this is not a one-size-fits-all situation, and there's some important things to consider. First of all, your group health insurance plan should be available through active employment. It's only going to be considered creditable coverage if it's through active employment. So where may this situation come up? If your spouse is retired and your spouse was offered a retiree health insurance plan until they hit Medicare age, but maybe you turn 65 before your spouse does, you cannot stay on that retiree plan even though it's offered through an employer. In order to avoid the penalty, the group insurance must be through active employment of either you or your spouse. The second disclaimer I'd like to mention is if your group health insurance is considered creditable coverage, but has an HSA available to you which you would like to contribute to, you do not want to sign up for Part A of Medicare. If your plan is considered creditable coverage, again, you can deny Medicare until you decide to retire, and you're not going to be penalized. However, you can only contribute to an HSA as long as you have health insurance that's compatible with an HSA. Part A of Medicare is not compatible with an HSA. If you sign up for Part A of Medicare and you still contribute to an HSA account, then you will be penalized on those contributions. In this situation, you will want to avoid signing up for Part A and B of Medicare until you retire so you can continue making contributions to your HSA. For more information on HSAs and Medicare, we have a video dedicated to this topic. But one more thing before we move on that I'd like to mention is when you do decide to retire, you will want to stop your contributions to your HSA 6 months in advance of that retirement date. Like I said earlier, you've already paid for Part A. When you enroll in Medicare, the government will backdate your Part A 6 months because you've already paid for it, and they are able to do that. So you need to stop contributions to your HSA 6 months before you would like Medicare effective in order to avoid any penalty on those contributions. A third thing to consider when working past age 65 is comparing your health care benefits with benefits available to you with Medicare. Your employer coverage may be creditable and a viable option for you without being penalized. But it could be that your benefits are far better with Medicare because your employer plan has high deductible and high copays that you'd like to avoid. A fourth thing to consider in this situation is your premium. Look at your pay stubs to see exactly how much you are paying for your group health insurance plan. You can then compare that cost with the costs of Medicare, and then you're able to make an informed decision based on premium costs to you. A fifth thing, one final note I'd like to mention is COBRA. COBRA is not considered creditable coverage. A situation that comes up at times is an individual is turning 65 but decided to keep COBRA the full 18 months until it runs out. Insurance companies will gladly take your premium in this situation, but again, you have to have creditable coverage through active employment. If you're on COBRA, you are not actively employed, and you will be penalized if you do not enroll in Part B of Medicare. COBRA is not an option for anyone turning 65. Now, if you're uninsured, if you have a marketplace plan or an ACA plan, if you have COBRA or a retiree plan, you will need to enroll in Parts A and B in order to avoid any penalty down the road. Now, let's say you've enrolled in Part A of Medicare, you worked a couple of more years, you're now turning age 67. First of all, you can enroll in Part B at any time and come off that group health insurance plan. Coming off a group health insurance plan gives you a special enrollment period to sign up for Part B of Medicare, so you don't need to wait for any special enrollment window. We advise Medicare beneficiaries to enroll in Part B 3 months before you decide to retire. You don't have to enroll 3 months in advance. You could even enroll and apply for Medicare a week in advance. We just like to have plenty of time to get all of your coverage in place before you go effective. Medicare allows you to begin your Part B enrollment process 3 months in advance, so we try to take full advantage of all of the time that we are given. If you'd like help getting enrolled in Part B, we can make it a simple process for you. Just give our office a call, 316-260-3331, and our team would be more than happy to help. For more information on all things Medicare, what Medicare covers, what it doesn't, the supplemental plans, drug coverage, just all things Medicare, you can call our office and request a free copy of my book, Medicare Made Simple, or just go to our website, advisemedicare.net, and request a free copy of this book, Medicare Made Simple. Our goal is to be a help for you, a blessing for you as you go through this Medicare journey, not just this year, but for years to come. So if you have any further questions or would like to talk through your situation specifically to feel better about your decisions that you're making, please give our office a call. This is the world we live in, and our team at Cornerstone would be more than happy to help out. Thanks so much for watching.